cauterize it first. I got to put an indwelling IV catheter without any forcing of the blood out yet. Just put an IV line. And you can then put your tourniquet, your S-mark bandage, put the final tourniquet, and then administer your lidocaine. You can do those. Here I just put 2 to 3 mL of lidocaine, but actually, when you're giving the lidocaine, you inject that until you feel a minor resist, and then you stop. You don't have to be stuck at 2 to 3 mL of lidocaine. Things to remember with IV regional block: onset is quick. The full effect, you have to wait for about 5 minutes to have the full effect. The duration is actually the duration of the tourniquet placement. But I'd like you to limit that to 90 minutes. You don't want to go over 90 minutes with IV regional block. So these are quick procedures, less than 90 minutes. Once you remove that tourniquet, there will be a return of sensation in about a couple of minutes. So this is the S-mark bandage I'm talking about. We have now the IV catheter in, and we are actually putting this S-mark bandage from the distal portion to the proximal portion of the leg, as you can see. So again, what we're doing here, we're forcing the blood proximally. We are desanguinating that leg, removing the blood. And once you reach that point, you put a tourniquet. This is the critical part of the procedure, is that you have to stop the blood flow. If you don't stop the blood flow, your block will be ineffective. You have to stop the blood flow. So once you put the tourniquet, you now can remove your S-mark bandage. Now remember, you already have an IV line, right? You have an IV line. It's already you already have a tourniquet. The next step now is to inject your lidocaine. Sometimes what I do is aspirate to see actually if I have desanguinated the leg. As you can see, I couldn't get any blood out. Next step would be to give the lidocaine slowly until I feel a little bit of resistance, and then I stop. So now I fill the blood, the vein with lidocaine. How does it work? How can the animal not feel anything? It's given IV, right? But the animal cannot feel anything. The reason for the mechanism of action is this: the local anesthetic diffuses to the nerve endings, causing the analgesia. And here's the limit I want you to remember. Do not exceed 6 milligrams per kilo of lidocaine in dogs. You cannot do this in cats. Why? One, like cats are very sensitive to the toxic effect of lidocaine, that's what we use. You cannot use bupivacaine with IV regional block. And there's no way the cat will tolerate this, even good sedation. But dogs, they tolerate, as you can see here. We have the surgeon doing digital amputation. This is a negative. You can see that there should be somebody at least kind of holding onto the dog, because the dog is only under sedation. Once they're done with the procedure, if you've done something that, if you've used something that you can reverse it, and the animal's away. It's not your procedure. Without really causing a lot of cardiopulmonary depression. I think I answered this question. Bupivacaine for IV regional, you don't use it. Never use it. Never use bupivacaine for IV regional because it is highly toxic. So that's any question on IV regional? I guess something that